Hey guys, thanks for joining me. Another episode of Conversations with Dr. Gosalia. We're here in Maryland at the ADA's Audacity Conference of 2019, and I'm here with two of my very close friends, Dr. Deb Abel and Dr. Nileshwar. Dr. Nileshwar is the current president of ADA, and Dr. Deb Abel is the president-elect of ADA. So thank you for joining me. Can you tell us a little bit about yourselves?
Pleasure to be here with you. Absolutely.
Thanks for having us.
Yes. So, as you know, our presidential reign, if you will, goes from January 1 through December.
Right.
So it won't be long before the reins will be handed over to Deb Abel.
Good. And where's your practice? You're in Lake Charles?
So I have practice in Lake Charles, Louisiana.
Good.
I've been in practice there now close to 40 years.
Good.
Yes.
Very nice.
We started in kindergarten.
Yeah. So how about yourself, Dr. Abel?
Well, as Ram said, I'm president-elect, and he has done an amazing job and leaves big shoes to fill. Fortunately, my shoes are smaller, maybe by a size or two. Anyway, but happy to do that. And this was an incredible organization. And I also have a private practice in my history.
Yep.
I had one in Ohio for probably about 14 years, and now I get to help other people in private practice with my job at Audiology.
Fantastic.
As manager of coding and contracting services.
Very nice.
So thanks for having us.
Yes, and you were in San Diego, the general San Diego area, and you moved recently.
I did, and I was with an ENT practice there up until January, fitting Bajas and still seeing some tinnitus patients. So,
Good.
Yeah.
Good.
So we'll see what life in North Carolina brings.
Absolutely. So you mentioned big shoes to fill. So yesterday, we had 174 audiologists up on Capitol Hill lobbying. Tell us about Lobby Day.
So it was a phenomenal event. You're right. This is the largest number of audiologists that have come to Capitol Hill for Lobby Day. We've had smaller groups of people in the past. Again, it's a testament to our commitment to move MAASA forward, which is the Medicare Audiologist Access and Services Act.
Yep.
So it was incredibly successful. All of the audiologists we spoke with that actually visited the congressional offices, including you, Amit, had great experience, and we've already started getting quite a few co-sponsors just between yesterday and now.
Correct. I heard
And
there
we're
were
still
six new co-sponsors
That's
as of
right.
this morning.
Yes, 3
That's
Republicans
exciting.
and 3 Democrats. That was this morning, so there's probably more between now and then. Who knows?
Yeah, and so the MAASA bill is actually a bipartisan bill created by Republicans and Democrats. But I think even more importantly, is this movement of audiologists is tripartisan, because it's actually ASHA, AAA, and ADA have all joined together to create this unity to kind of help us move forward, and that's how important it is, including a consumer group, the HLAA,
Right.
who has joined in supporting this as well. I was on Capitol Hill, as you mentioned, and I thought it was a no-brainer after reading it many times over and over again, trying to find out what would be the negatives, and I can't find any.
Right.
Yeah. So
Very good.
Tell us more about the MAASA and how it got here. What are your thoughts about MAASA?
Oh, sure. Well, I think the important part about MAASA is the three principles of what's
Good.
going to happen, and just to kind of go over that quickly,
Yeah.
just so everybody knows,
Absolutely.
if they're not already aware. And sometimes it's good to hear it again. So the first part would be to enable patients, to Part B Medicare patients, to come to audiologists directly without a physician order. Sure, there's still going to have to be medical necessity be met, but you don't need the order. So that's the first part. The second part is to change our status from supplier to practitioner.
Correct.
And then the third part is to enable us to work within our scopes of practice that are determined by our state licensure boards, to work within those scopes of practice to provide all the services that we provide to Medicare Part B beneficiaries,
Correct.
which at this point, many are not covered in terms of treatment,
Yeah.
are not covered by Medicare Part B.
Correct.
This also enables Medicare beneficiaries to be on the same par with other people who have direct access to us. VA, for example.
Correct.
We highlighted in our meetings yesterday that, what the staff and their boss, the legislator, with their FEH plan, they can come to us directly.
Correct.
So that seemed to kind of click. We saw that kind of click in a couple of heads during
Right.
the day.
Absolutely.
But it was funny you said about shoes and filling shoes, because I think we did a lot of steps yesterday.
We sure did.
And it was great. And just to meet with staffs and legislators, because many of us did. We had one come up to us asking about why were we all wearing green ties
Yeah.
and scarves. And
Absolutely.
it was a great opportunity to educate somebody who was not even on our list, but whoever got to see him, I'm sure they were ready.
Yes.
So, yeah.
Absolutely.
Indeed, there's a tremendous enthusiasm among all audiologists, the entire audiology community, to move this bill forward.
Yes.
And if I may just add one more thing
Yes,
to
please.
the,
Of course.
individual organizations that have actually endorsed it. Many of the state academies have also endorsed the
Correct.
bill, which is also awesome.
Absolutely. Absolutely.
Yes.
You guys also met with CMS yesterday as well. I think it was it you, Dr. DeSarno, and Dr. Shu?
Actually, it was Dr. Shoup, Dr. DeSarno, and Stephanie Chayefsky, our executive director
That's correct.
of ADA.
I'm sorry. That's right.
And there were a few others. I think there were a couple of others from ASHA as well. And
Good.
Dr. Cabot was there.
Yes.
That's right.
Who's that?
Kim Cabot.
Kim
Dr.
Cabot,
Kim
absolutely.
Cabot was also there.
I think that was a good conversation, that at least getting CMS involved and maybe some other aspects of this whole protocol
Yes.
that we're going through.
So, if I may add something to that, the element of direct access without a physician's orders, that can be done administratively without, outside of statute. In other
Correct.
words, without actually having to go through a law.
Right.
So I think it was important that CMS understands the importance of them, taking action on this and understanding that they can actually do the direct access piece as well.
Right.
That was the purpose of the meeting.
Yeah, and that's amazing because
Yes.
This bill hasn't been scored yet, but there was a previous bill with direct access that was scored, and it showed a savings of almost $240 million over 10 years. I believe those are close numbers, maybe. And that was a previous bill, of course.
Correct. So I don't know that there was actually a CBO score per se on the bill. However, it's a no-brainer. There's tremendous cost savings.
Correct.
Especially when you factor in the cost to untreated hearing, the consequences of untreated hearing loss.
Yes.
You've got fall risk, memory issues.
Yep.
Lots of other issues that we all, as audiologists, know.
Yeah.
And so there's mounting evidences, into all of these untreated hearing loss consequences that
Yes.
we know too. So the costs are huge. So
Yep.
these are conversations that we have with our congressmen and congressional offices, and they ask about the scoring issue.
Yeah.
And then we explain to them the costs that are associated with some of these consequences of untreated hearing loss. They understand the importance of the bill.
Right.
They said, yeah, well, that's true.
Yep.
And that's why they sign on to the bill.
Absolutely.
Is there anything else you want to
Yeah,
add?
I would love to, if you don't mind. I think the other thing that are not only the obvious costs that Ram just displayed, but the cost of how many times a beneficiary winds up going to the audiologist's office and for one reason or another doesn't have the order. Their ear is full of wax and maybe the audiologist isn't comfortable doing it, or their state law doesn't allow them to
Correct.
do it under certain situations. Now you've got the inconvenience of probably a family member who had to take off work
Correct.
to pick them up, take them to the office, go back, and now you've got 2 visits.
Yep.
And it's just so many extra layers that are just so not necessary.
We heard a story yesterday, actually, from not us. It was actually a legislative aide about a patient who lived in a rural community, had to drive 100 miles to their audiologist, didn't have their physician order. So they had to drive back 75 miles to the physician to get the order and then eventually have to go back. And it wasn't them driving. They did have to have somebody bring them. And that inconvenience, the distance, it's just, we're talking to patients that have hearing loss, and we're telling them over the phone what they have to do, and they don't know. They don't hear what
Yeah.
what the rules are.
Absolutely. So, true, the inconvenience and the cost associated with, and while it's true that sometimes the patient can just merely call their physician, and the physician will sometimes shoot an order over to the audiologist. That's the shortest route, obviously, and the
Yeah.
quickest way to do it. But is that necessary?
Correct.
Why is it necessary? Principally, it is not.
Correct.
So that starting from that is where this bill, I think, makes sense to individuals that are in the business of providing care for seniors that need the care, and just improving efficiencies.
Yes.
And when you improve efficiency, the costs also decrease.
Correct. Absolutely. Well, this has been great. So there are a lot of folks online on social media who couldn't make it for Lobby Day. How can they do their part or get more involved?
That's a beautiful question. There's lots of things they can do at home, for instance. They can invite their lawmakers, for example, to come visit their practices or their place of work, and they see on the ground the type of work we do, the services we provide to our seniors, and the congressman can understand the value of the services. So that's definitely one thing they can do. They can
get their hearing tested
That's
too while
true.
they're there.
Yeah, exactly. But they can't get the earwax removed. They have to go back to the physician, even though it's a covered service, right?
And they can come direct to us, though.
That's true. If they're Medicare Part B.
Right.
So that's certainly something they can do. They can also go to chooseaudiology.org, where
Yes.
they can find Congressional Connect, and they can get constituents, Medicare beneficiaries, and just audiologists if they want to also advocate for it, which we hope they would,
Yes.
and send emails directly from Congressional Connect to the congressman, so
Yep.
they can, and asking for their support.
Absolutely. And I shared a link earlier. I'll share it again in the comments below. Chooseaudiology.org, and people can actually find not only the PDFs and the documents, even some wording that they can use in letters and
That is
things of that
exactly
nature as
right.
well.
Yeah.
Well, and the beauty about the website, to go to the website of whether it's ASHA, AAA, or ADA, the letter populates. You can just change it a little bit if you want. You can send it as it is. It's great. And the other thing, if you don't mind me saying so, as the holidays are approaching and they're coming home to their home districts, make an appointment to see them in the home district as well.
Absolutely.
And talk to them, or they go to Chamber of Commerce events, make sure you introduce yourself and tell them your story. It's pretty powerful.
And it's amazing, a lot of the congressmen and women actually have moved to the DC area, even though their district is, like for us in California. A couple of the members that I met yesterday have actually moved to the DC area. So when they go to California, which is not an hour flight, they want to fill their schedule with things to do with their constituents. So it's not hard to have them come out and meet. And we invited 4 out of the 6 to come out, and
Yes.
they've all agreed to do that. And we're going to grab a group of audiologists in the greater Los Angeles area, and we'll do something, either a dinner event or have them come to one of our clinics. And it's a very simple thing to do.
Terrific. That's what we need to do.
That's fabulous. Fabulous.
Thank you.
This is common sense law. It makes sense to audiologists. It makes sense to consumers. It makes sense to the lawmakers. And that's why I think we're gaining so much momentum with this. And like you said earlier, Amit, with the 3 major audiology organizations behind it, consumer group behind it, and a lot of the academies, the state academies are behind it. That's why it's gained so much momentum.
Yes.
Just if you think about it, the House bill was introduced at the end of July, and it's already gained so much momentum. We have so many co-sponsors already on the House side.
Yeah.
And it's bipartisan, which is both Democrats. So common sense is appealing to whether you're a Republican or independent or Democrat.
Correct.
If it's common sense, and if it's meaningful, they will buy into it.
Yes.
Right?
Absolutely. So of course we're here in beautiful the Gaylord Convention Center in Maryland. Any last words about ADA and where you see audiology moving forward?
Oh, that's
Please.
a great question. I think it's obvious by coming to this meeting that independent audiology practices are here to stay and thrive, in spite of some concerns people have for the future. People are always going to need our services. We heard a very wonderful presentation this morning from Dr. O
Yep.
from Johns Hopkins, talking about dementia and hearing loss, there will always be a need
Absolutely.
for what we do. And I think that was very well validated today. If anybody has any concerns about those things, this ADA is a wonderful home for any audiologist, especially those in private practice.
Yes.
Yeah, if I just add one more thing, and I'm going to refer to my phone because I don't want to make any mistakes when I read this.
Please.
It's a long sentence, and it's the mission of ADA. The Academy of Doctors of Audiology is dedicated to the advancement of practitioner excellence, high ethical standards, professional autonomy, and sound business practices in the provision of quality audiologic care. And we're driving home the fact that while intuition is okay, it's good, and a lot of the research sometimes stems from initial intuition, but I think depending on evidence-based, sound evidence is important. And we keep that in front of us all the time when we develop, models of care, business practices or best practices that we can deliver care, keeping that one focus, and that is evidence-based care.
That's perfect.
Yes.
Perfect.
Thank you.
Future of audiology?
Looking bright.
I can what?
Looking bright.
Absolutely.
Thank you.
Thank you so much, guys, for joining us. ADA is www.audiologist.org. The link again is down below. Thank you both for joining me. I know you both are very, very busy, and we appreciate you taking the time.
Thank you for having us.
Thank
Thanks
you.
for the opportunity of talking about ADA and MAASA.
Absolutely. Thank you, guys.